All right, good evening, everyone, and welcome to the Baptist Health For Her Restore Your Core 4 series. We are back again here tonight, and I'm excited for you all to be joining us. So if you don't know me, my name is Jean, the host for the series, and I'm actually joined again by Wendy Camp. She works with our Baptist neurology and is a nurse practitioner. And really, Wendy, you did an introduction last week, but anything to add for the viewers who may not know you?
Yeah, well, so I'm a nurse practitioner from a lot of different backgrounds by training. I've done a lot of neurology, neurosurgery, and neurocritical care. And I've treated sleep disorders a lot in the past, and it's just kind of an interest of mine. And I really enjoy helping people kind of sort those things out and find better ways to sleep. So
Yeah, awesome. And we're so happy to have you. I know this is our second week together. And as we kind of talked, backstage, there's just so much that has to do with sleep. I mean, sleep is kind of complicated. And I know last week we talked a lot more about kind of the behavioral aspects of
mhm.
sleep. This week we're going to be getting into more of the common sleep disorders, things like that. But I know we did shout out to our viewers if they had any questions in the interim between, our weeks. And I know we got a few of those. So Wendy, we wanted to talk a little bit about first kind of that staying asleep aspect,
Mhm.
right? And then a couple of other things.
Yeah. So part of insomnia, it's not just the initial, getting sleepy and falling asleep. I think that's kind of what most people think of when they think of insomnia is you just really have difficulty going to sleep. But there's also part of insomnia which deals with being able to stay asleep once you have fallen asleep. So there's a lot of things that you can do if that's the case. And a lot of the causes for that are very similar to, the difficulty falling asleep. So anxiety, stress, lack of good physical activity, things like that. And then obviously, diet can play an important role in that as well. So, we talk about sort of avoiding heavy meals close to bedtime, and that's really important for staying asleep as well. But there are some things you can do if you do find yourself in that situation, in addition to some of the tips that we talked about for the sleep reset. So, a really good schedule, putting yourself on a consistent wake and going to bedtime, the bedtime routine, all of those things. Being able to stay asleep a lot of times requires a little more work on your part. And so a lot of the things that you can do, though, really relate to relaxation. So exercising, so relaxation exercises and deep breathing exercises. And there's a ton of information online about this stuff. The National Sleep Foundation has some really good information about that. And we'll give you guys some links, I think, in the comments so that you can find these resources a little bit later. But there's some really good, pretty sound information on what to do if you're having trouble staying asleep. So, really doing things to reduce your stress, avoiding things that kind of cause your stress level to go up. So right now that's pretty easy to find in the news usually. So, trying to avoid things that really get you into sort of an argumentative state or really kind of raise your blood pressure, things that put you kind of on edge, really trying to avoid those things close to bedtime. And then if you do find yourself waking up, the common rule is to sort of give yourself maybe 20 minutes to go back to sleep. And if you're really not able to, don't stay in your bed because then you sort of create sort of a negative association with your sleeping space. So you'll want to get up, leave your room, and do some of the relaxation techniques once you've left. So things like yoga could be really helpful for that, or some sort of deep breathing exercise. We can talk a little bit more about those later if you'd like, but there are some apps that can help with this that can put you through some guided meditation and guided imagery, or even have some music that's been sort of set to a certain tempo that really helps promote sleep and kind of helps your brain calm down without you having to read a book or, do something to keep yourself occupied while you're trying to get sleepy again, right? Because I think the most common thing that I heard generally was, okay, well, I'm awake in the middle of the night. What am I supposed to do, to help myself get sleepy where I can't turn on the lights and I can't, I can't look at my phone or watch TV, because those are the things we tell people not to do. So technology and the internet have given us some really cool tools to be able to do that. There's a couple apps, I think, Calm and Headspace, and there's another one I'm not thinking of, but all of those have certain sections for you to sort of help you go back to sleep if you are awake. So there are some music that sets to a certain tempo. I think it's like 60 to 80 beats a minute. And it's nothing too crazy. It's not going to keep you awake. There's also, like I said, we talked about the relaxation breathing. There's something called the 4-7-8 technique, where you inhale for 4 seconds, hold your breath for 7 seconds, and then exhale for 8 seconds. And you kind of go through that cycle 8 times, really focusing on expanding your lungs. And so you're really paying attention and trying to preserve a specific technique. And so it takes your mind off of the fact that you're not really able to sleep, and it kind of reduces the amount of anxiety that people have about not being able to sleep.
Yeah. So really the point of it is to kind of take your mind off of that,
right.
and those thoughts. And I mean, I know for me, like if I wake up in the middle of the night, my first thing is like, I want to go, watch a show to like relax. Right. But it's kind of like you said, that's the opposite of what we should do. But using technology to our advantage anyway seems to be the key.
Right. Well, and the other thing too, a lot of people have a lot of anxiety about not being able to sleep, right? So you can't, you're kind of watching the clock and you're like, geez, I got to get up in 4 hours. And, so it just produces this like vicious cycle of clock watching and anxiety. And then you can't sleep because you're watching the clock, and which is the reason I can't take a 15-minute nap, because I'm constantly like, okay, has it been 15 minutes? Like I can't do it. So I just don't. But you can use these apps to sort of help you, because then it takes your mind, it allows you to focus on what's happening within the app, whether it's storytelling or music or whatever. It helps you focus on that without really having to pay attention to the fact that you're not, sleeping. And then that helps get your mind in a place where it can, drift off to sleep a little more easily.
Yeah. And what's nice is, I know for the ones that I've used, it has a timer for itself, because we don't want it to continue to run, right? Because if we do, that may wake us up again, right?
Eventually, yeah, it can help you. I think in some of the lighter stages of sleep, it can actually, wake you up a little bit. So yeah, the timers are helpful.
Awesome. Well, those are great tips for just kind of that in the middle of the night, taking your mind off. So appreciate that, and kind of follow up. I know there was another specific question that we had. Right. It was about ringing in the ears, which is called tinnitus. Is that how you pronounce it? Okay. Yeah. Could you tell us a little bit more about that and sleeping?
So tinnitus is really common. A lot of people have it, and it can be related to a whole lot of things. So if you've just kind of had it forever and that that's, it's just a benign, sort of not harmful ringing in your ears, then the things that you can do, it becomes more problematic at nighttime, obviously, because we're in a quiet room and we've laid down and now we're trying to go to sleep. And the only thing you can hear is this ringing in your ears, right? And so I have this, it sounds like white noise in my head, which is nice if that's all it sounds like, but if it sounds like some of the other sounds, so some people report sounds like jackhammers, or, those are usually more transient, like that's not their the constant sort of hum in their head usually. They report it sounding like a loud truck, or, things like that. So it can actually be pretty loud for some people.
Wow.
So really trying to avoid things that make it worse. So avoiding caffeine. I think alcohol can actually make it worse sometimes. And then using things that can help you sort of drown it out while you're trying to go to sleep. So that's where the music comes in, or, a good white noise machine. And I think I posted the link to the one that I have. We bought those when we were living in a really, really tiny house, and they were constructing a new house next door. And I just brought a new baby home. And we have 4 other kids, and like we needed it to be quiet in this tiny little itty bitty house. And those things work like remarkably well. And it actually helps. I mean, we've kept it because we've realized it's a lot easier to sleep with, even with the tinnitus. Like it helps kind of drown it out. You don't even notice it. You're just kind of out. So white noise machines can help with that. And then just really following some of the other basic sleep hygiene techniques we talked about. And then if you have any conditions like obstructive sleep apnea or TMJ disorders, treating those things can also help with the tinnitus, because they all tend to sort of be associated with each other. So
interesting. And I know we're going to get a little bit more into sleep apnea tonight, right? With a few of the things that we're talking about. Cool.
Yes.
So I know, was there any other questions that we had come across that we wanted to address before I move on to sleep disorders?
I think those were the main two that I remember seeing. And I
Yes.
know, well, there was one where I sort of recommended seeing a sleep disorder specialist. And so we can kind of go through, when you would need to seek help. So, typically if you're really just struggling with sleep for more than a couple of weeks, it's probably time to go see a physician. So your primary care can kick this off. This doesn't have to be, a specialist on your initial visit. But if you've really been struggling for a long time, you need to get somebody to help you walk through this, through these disorders. And most likely that initial visit is not going to get you an answer. It's just
Mhm.
going to be the start of kind of an investigation into your sleep, into your sleep issues. So a lot of the things that we've already talked about will kind of be the basis of the questions on an initial visit about a sleep disorder. So they'll kind of go through habits, lifestyle, what kind of caffeine are you drinking and when, how much alcohol are you drinking and when, what's your diet like, what's your daily routine like, are you exercising, are you smoking, like all of those things are going to be part of that conversation because they're all related. And then once you kind of get through that initial history and questionnaire, then they'll probably move into some screening tools, to sort of look for some of the common sleep disorders like obstructive sleep apnea, restless leg syndrome with what we call periodic limb movements and things like that. But they'll also probably ask you as part of that initial visit to keep a sleep diary. And so I
Oh,
know I sent you a picture of that sleep diary earlier. This one's actually from the National Sleep Foundation. But this is kind of a good way. They usually recommend that you track this for at least 2 weeks. And so you would use this diary when you wake up in the morning, and that's the orange side. And then right before you kind of go to bed at nighttime. And it'll look at things like, whether you've been exercising, are you napping today? How sleepy are you?
mhm.
So that template can be really helpful and can give your physician or your advanced practice provider a lot of information when you show up to really talk through these sleep issues.
Okay.
So if you may want to just come prepared. If I know sometimes it's not really easy to just call and make an appointment and get in tomorrow. So if you've got some time before your visit, you might want to go ahead and just do the sleep tracker so that you've got it, kind of ready for that visit, and that may help save some time a little bit if you've already done that.
Yeah, no, that's some great advice. And, why not do a lot of the legwork even before you go see,
Yeah,
your physician so you can kind of quickly talk through those other areas, or maybe not quickly, but, identify those so that they
right.
have that to see. And I did, Wendy actually put a link in the comments just so everybody can see just a template of a sleep diary so that they can have it for themselves to, if
Oh,
they need
awesome.
that. Yeah,
Great.
perfect.
So that's kind of, what you would expect if just from your initial visit with potentially a primary care or even a subspecialist. I mean, even in neurology, we would kind of go through all of this stuff initially, even if you've already been through it with your primary care provider. And then, the next step may be to order a sleep study. If you're really just not making any progress, I mean, they might make some recommendations and say, this is probably just a temporary issue. Let's try to reset your routine a little bit, and they might give you some medication to kind of help or recommend some OTC meds, some over-the-counter things to help. Benadryl can be helpful for a short period of time. Things like, I'm trying to remember, magnesium supplementation. And I think we've
Mhm.
kind of talked through some of the more like quote unquote natural remedies. And like I said, they'll probably recommend some of the behavioral reset stuff. But occasionally they'll want to rule out some more sort of pathological sleep disturbances. And, especially if you've been through behavioral therapy and all that stuff and you're really just not seeing any improvement. Or they may want to do it just as a matter of course because of your history. So the story that you're telling them may give them a clue that there's something more, insidious or more serious going on than just sort of the cognitive behavioral, stuff that can
Yeah.
cause some, sleep disruption. So if that's the case, they'll recommend a sleep study. And the sleep studies usually they take most of the time you just need one. There are some certain circumstances where you might need more than one, and there's a special for things like narcolepsy, you might actually need 2 or 3 different sleep studies. But the initial sleep study will give them a lot of information. It'll kind of tell your provider how long it takes you to fall asleep, once you do fall asleep, how, what do your sleep cycles look like? Are they normal? Are you getting to each of the stages of sleep kind of in the same amount of time or within the range of time that they would expect you to? And then are there some other things that are happening while you're sleeping? Do you have unusual movements of your arms and legs while you're sleeping? Do you have some issues breathing while you're sleeping? Are your oxygen levels dropping? Are you not able to take a full breath? Lots of people, and that's sort of leading into the obstructive sleep apnea part. But then there's also some neurological sleep disorders that really don't have anything to do with either of those issues. And the sleep study is really kind of the only way to tease those things out. So,
question for you about, sorry, Wendy, for the sleep study. So I've never had one before, and I know you're probably obviously you're familiar with them. What does it look like? Do you have to stay somewhere? Can you do it at home?
Yeah. So the answer to both of those is yes. It just kind of depends. It depends on, the situation. The home studies, I think, have gotten a little bit better than they used to be. They weren't very good for a long time, but they're probably a lot better now with newer technology. But typically speaking, what will happen is they'll put we have kind of a picture, but they'll use some EEG electrodes. And they're very small and they're just kind of sticky, and they'll stick those on your head with some very thin wire. And I'll say I've had a sleep study, and it really, it really wasn't that hard. Of course, but they'll put some wires on your head and on your chin, and then they'll have a little sensor that kind of goes underneath your nose. And then there will be some things sort of hooked up to your chest. And the things on your chest are meant to monitor, the way that you're breathing and whether you're able to take a full breath. And they potentially may have some EKG electrodes as well. And you'll have an oxygen sensor on one of your fingers. And so what they're really looking at here are your brain waves. And they're also looking at your chest rise and fall, and whether you're able to take a really good deep breath. And then they're also, like I said, looking at your oxygen levels to see if those are dropping while you're asleep. So we're looking kind of for the obstructive sleep apnea stuff. We're also looking at, there'll probably be some little electrodes on potentially on your arms and legs as well. And like I said, these are very small. I didn't find it difficult to sleep with those things on. I know some people do complain about that, but try to go into it with an open mind. It seems like you might not be able to go to sleep, but you might surprise yourself. And sometimes we get pretty useful information, even though people feel like or report that they don't think that they fell asleep. They actually did. And we were able to get a decent amount of information. I mean, there are occasions where you'll get a sleep study report back and you're like, this is, I can't really make heads or tails of this. But for the most part, I mean, for probably 90% of patients, we get pretty good information. So, So I would say, you go into the sleep study and it gives the physician or provider a ton of information. And then they kind of have to make heads or tails of that on the back end. Is there sort of a neurological component to this? How often were their limbs moving at night? Because, your arms, if you have something like restless leg syndrome, you may also have a condition that creates movement at night while you're sleeping. And so it might be kind of difficult for you to stay asleep just because your arms and legs are moving a lot. So that, and then sleep apnea, obviously, your oxygen levels are dropping, and the fact that you're really not taking a good deep breath often enough will actually, kind of wake you up. And that's, even though people think that they've slept or feel like they haven't woken up necessarily, the quality of their sleep's been very poor because they haven't been able to get into all of the stages of sleep for the amount of time they need to be in them.
Yeah. That's really interesting that, hooking all these things up for just one night of sleep can tell you so much, but that's awesome.
It's very interesting. Yeah.
Very interesting. So I know you mentioned a few different common sleep disorders, which, restless leg syndrome, talked about narcolepsy just a little bit, insomnia, and then also sleep apnea. So out of those, I mean, what would you like to focus on mostly for our conversation as far as, ones that maybe are most impactful? What are your thoughts?
Well, being a stroke program director and dealing with chronic disease and illness, all sleep disorders actually do contribute to chronic disease. And so if you have a sleep disorder, you want it to be recognized and treated, because it can, it really can impact your quality of life. It can impact your your blood pressure. It can cause diabetes, all of those things that we really want to try to avoid. Getting good sleep is important for all of those things. So I think, but my big passion is sleep apnea. And I'm sure if my mom's watching, she'll tell you that's true, because we talk about it, we talk about it with our friends, and we talk about it with our family members, and we talk about it, we'll go talk to anybody about it. But I think there's kind of a stigma around sleep apnea a little bit, and people are a lot of times resistant. So even if you mention that somebody might have sleep apnea, they'll sort of be like, well, I'm not going to wear a CPAP machine. Like, there's no way that's going to happen. Like, I'm never going to do that. So don't even talk to me about it. Like, my wife says I snore, but I know I don't snore. And it's like, well, you're asleep. How would you know if you're snoring or not? So, so chances are, if somebody says that you snore, you do. And there's a lot of questions that we would ask. So, are you sleepy in the daytime? Do you find yourself getting sleepy? Like, if you're sitting in the car, how likely are you to fall asleep if you're in the car, or if you're reading a book, or if you're watching TV, and all those? So I'll ask you a bunch of those kinds of questions, right? And then to figure out if we think that you have sleep apnea or not. And then we'll send you for the test. But if people are diagnosed with sleep apnea, and I think I have a picture, I think maybe we should start and talk about what sleep apnea is.
Yeah. And I know you mentioned so much that I didn't know about how impactful it is to health.
Yes.
So I definitely want to touch on that too.
So let's just kind of back up a little bit and talk about what sleep apnea is and what it does and why it's so important to treat it.
Let me pull up that photo.
Yeah.
There we go.
Okay. So I found this, and whoever made it did a good job. So on the left side, where you see normal sleep, this is kind of a picture of a person lying down. And this is a cross section through their face. So you're looking sort of, if you had X-ray vision or ultrasound vision, and you're looking into their face, and the bottom sort of pinkish cavity where you see the bottom blue line sort of making an arc through that's your mouth. And then obviously the top blue line is kind of going through your nose into the posterior pharynx, the back part of the throat. And so that's how air would normally flow when you're sleeping, or should flow when you're sleeping. So whenever we fall asleep, our tongues relax and they kind of fall back. And so does, all of the muscles in our jaws and neck sort of relax. Okay. So for certain people with certain anatomy, so if you have a short neck, or you have kind of a recessed jaw, or, all of this stuff is hereditary, right? So you can just thank your ancestors for like horrible neck anatomy. And chin anatomy, but all of those things can kind of impact how air flows while you're sleeping. So if you start to snore, that means that your airway is partially blocked while you're sleeping. And that may or may not be a big deal. It may just be that there's some, as those tissues relax, that some of it is moving. It creates, it can create some turbulence, and some of that tissue is moving, and that's what the snoring is. The issue happens on the far right-hand side, where you see obstructive sleep apnea, where the airway becomes completely blocked. And it's not able to open because you're sleeping, right? So you can't tell it to open itself. And so with obstructive sleep apnea, the airway is completely blocked. So people aren't really able to take a full breath, and their oxygen levels may fall, or they may or may not fall. But over time, not being able to take a really good deep breath and then having lower oxygen levels creates some issues with the blood vessels all over your body. So in your heart, in your lungs, in your brain, in your kidneys, and it creates some pressure changes, and it leads to damaged blood vessels. And so that's really where the danger for sleep apnea comes in. It can cause sudden cardiac death. So people can sort of die in their sleep from sleep apnea. It can cause strokes. Even if that's your only stroke risk factor, you can have a stroke from sleep apnea. But it also can create some issues with just difficulty controlling blood pressure. So if somebody has really high blood pressure that they're not able to control, sleep apnea may be playing a part in that. So it's really important, if you've got sleep apnea, to recognize it and treat it, because you can kind of reverse some of that damage, if you can treat the sleep apnea.
Yeah. And so is like a CPAP machine, is that the only thing that really? No. Yeah. Okay.
No, it's not actually. It's kind of the more common thing, and it really depends. And the physician that's treating you for sleep apnea would kind of have to walk through all of those options for you, because it really depends on how bad the sleep apnea is, and what it's caused by. But, if you have very mild sleep apnea, sometimes, a lot of people hate the oral devices, but it does work for some milder forms of sleep apnea. And so that's kind of like a mouth guard. But then, if you have TMJ and things like that, the mouth guard can actually be harmful. It can make your TMJ worse. So you kind of you'll have to troubleshoot that one a little bit. The CPAP is a pretty common option. And so the CPAP works by, kind of think back to that picture where the airway was blocked. The CPAP actually uses positive air pressure. And so, people always say, well, it's like breathing in a wind tunnel. I feel like a dog sticking my head out the window of a car is kind of the common description people give it. But I'll tell you, when I was in training in the ICU, we had to do my attending, Dr. Koch, she made all the residents and the nurse practitioners play with the ventilator. And so we actually would have to use a mouthpiece and sort of let the ventilator breathe for us. And so we got to experience how all of that feels. And so we always kind of joked, like the person, when you got down to what we would call kind of CPAP or just pressure support, the person who had been on call overnight was going to fall asleep, because it just you kind of have to focus on your breathing a little bit to control, because of that pressure. It feels weird. But then you just fall asleep like instantly. And so they would all be sitting in the chair, and all of a sudden you just kind of see them doze off, with the CPAP on their face. So it was kind of funny, but it really does. I mean, it works because it just holds the pressure from the air actually holds those tissues open, so that you don't, so that they don't close off and you can breathe. So.
Yeah. And so another question too is, if you have sleep apnea and do need to have a CPAP machine, is it kind of indefinite that you need to have one?
No, not necessarily. No? Not necessarily. So for instance, I had some issues with sleep apnea during one of my pregnancies. And then I didn't have it afterward. It was just kind of a condition of having I was also borderline preeclamptic. So I had some swelling, and once all of that went away, so did the sleep apnea. So, there are some situations where it might be temporary. Some patients, that are obese and have a lot of extra weight in their neck and their chest, when they lose weight, sometimes the sleep apnea can become a thing of the past. So sleep apnea makes it hard to lose weight. So if you have sleep apnea, it is really challenging to lose weight. And then sometimes once people start treating it and then they start losing weight, and then the sleep apnea can kind of resolve itself. There are some anatomical things that can be corrected. And so this is why it's really important, again, to see a sleep specialist. They may refer you to like an ENT to have an evaluation of kind of the anatomy in your face and in your head and in your neck to see if there's anything there that can be corrected to fix the sleep apnea as well. And there's also a new device called Inspire that is an implantable device that works with one of the nerves to help keep your airway open if you do have sleep apnea. But again, all of that sort of has to be sorted out, by your sleep physician, because it can be a little tricky. But they, that would be the person that would help you walk through all of those options and find the one that's right for you.
Yeah, no, that definitely makes sense. Seems like it's a lot of, more detective work, really, and just trying to figure it out. Yeah. Interesting. Very cool. And yeah, I mean, I learned, so much, especially about just kind of some of those risk factors that you have, that sleep apnea can lead to, other chronic conditions and things like that. So I personally had a question for you, Wendy, about sleep trackers. So kind of taking a little bit of a different, going to a different direction here. So what do you think about sleep trackers? Do they really work? Is that something that is useful when you're having sleep issues?
I mean, I haven't done a ton of research on that. I think it's kind of hit or miss, and it probably kind of depends on your device. I know like my watch is not going to survive long enough for me to wear it in the daytime and then wear it all nighttime to track my sleep. But if you do have one of the ones that has a longer battery life and it can take that, I mean, it definitely will it tracks your movement. Some of them actually will track your oxygen levels too, and your heart rate. And if that's the case, it may actually give some pretty helpful information, as long as it's accurate. And there has been some variability in those devices. So it sort of depends on the device. Yeah. There's probably ways you could test it out to see if you think it's accurate or not. I've personally not ever used one. But I will tell you, as time goes on, that technology will get more and more accurate, and we'll be able to get a lot of good information from it. But I think there's probably some out there right now already that are pretty stellar. I just haven't used them. And again, I would tend to say that it's the more reputable brands that on the devices that have a longer battery life, because it's going to need to be able to last, long enough to go 24 hours without a charge. If you're one of those people that likes to count every step from the moment you wake up, it's going to be kind of hard to find a time to charge it and monitor your sleep. So
yeah, exactly. Okay. That's great insight. And also, I mean, if you're looking to kind of evaluate your sleep yourself, let's just say before you go to a physician, you would say that probably using the diary is more useful than a sleep tracker?
Well, I would probably use both. And, the sleep tracker will tell you if you're having trouble with your sleep. But again, some of those lifestyle things will create that problem. And so for instance, if you're, if you like to drink alcohol to go to sleep, for instance, and we talked about this last time, alcohol actually disrupts the sleep cycle. So your watch might pick up the fact that you're kind of moving and you're waking up, and it notices some heart rate variability and things like that. But then again, it's not really going to tell you why. So it might help you sort of pinpoint what's happening while you're sleeping, but the diary is really helpful for sort of examining those daily habits, the behavioral things that are contributing to the sleep, to the sleep disorder. And again, a lot of those, they sort of, they're caused by something, but then in turn, they also make your sleep, worse when you do those things. So it's you kind of get stuck in this vicious cycle. So it can be a real challenge sometimes to figure all this out.
Yeah, definitely. I see we have a comment here from Kara. She was curious about some advice for those with hot flashes. So what can you tell us on that?
Goodness gracious. That's like a whole other conversation. It was funny. I had actually done some research a little while ago, just sort of looking into hot flashes in general. And I think there are some physicians on social media that sort of specialize in women's health, and they actually talk about this kind of thing. It's a challenge. I don't know that they've really found anything good for the vasomotor symptoms of like pre and perimenopausal women. It can be really tricky to treat. So, they've done research on things like certain blood pressure medications that they think would help control those symptoms. It doesn't seem like there's been anything that's really been proven to be like, yeah, this is really what we want to use for those situations. It's definitely a challenge. And I would say also, it could be hormonal, but it also could be something like, a sleep apnea situation. So you would want to make sure that you don't have risk factors for sleep apnea, or there's none of the other things going on, because sleep apnea can also cause you to have hot flashes. So it could be hormonal, but it could also be, something else. So you definitely would want to sort that out. And then maybe talk to your GYN or, your women's health provider to see if they have any good advice for the hot flashes, because I know that plagues a lot of women.
Yeah. Yeah, so. Definitely good advice and resource. And I think too, just to ask the question of, hey, could this be more than just hormones, right. So that's very interesting. Yeah. One other question that I had, and I know we're getting close to our time, but I get a lot of questions, or at least when I was working with clients.
Vera's comment was really good. That's super funny. This virus can't survive the temps. I would say if you're really struggling, cooler showers, really cold temperatures, don't just do what you can to mitigate the temperature. There's probably, I know there's there's cooling devices, I think, for your bed now. If you have a partner that you sleep with, they may not appreciate that, but you know what? They may not be dealing with the hot flashes either. So, you do what you got to do.
I think someone mentioned last week, not to be partial to any, device or anything, but a chili pad. But I know there's a bunch of different ones that you can look up just for like cooling at night. That could be really helpful, I'm sure.
Yes.
Yeah. But anyway, so my last question for you, Wendy, was just to touch on over-the-counter sleep aids,
Mhm.
and really what role does that play? Like, is it like a cure-all or, I mean, what can those be useful for?
Yeah. So again, this is not medical advice because I
Of
don't have
course.
your history in front of me. So
Yeah.
I think that, sleep aids do play a role. And sometimes you've
Mhm.
had, a week where you just can't get yourself together and you're just super tired and you just need to go to sleep. And so things like, Benadryl or Unisom can be helpful in those situations, but they also can sort of mess up the sleep cycle on the back end. And so it's really important to try to minimize, oh, look, I forgot to mute my computer and you all just heard my email come in. Hang
No,
on.
that's okay.
So hopefully I shouldn't be getting that too many this late at night. So yeah, Benadryl, things like that can be helpful in the short term. And I think a lot of people use those, especially like I said, you've had 2 or 3 days where you just haven't really slept. And because you haven't slept, now you're just kind of in this like weird, grumpy, agitated, I can't go to sleep state. And so Benadryl can be, those things can be super helpful in that situation if you just need to like go to bed, like just take it, go to bed, sleep for 12 hours, get up the next morning and you feel better. But they can sort of mess up the sleep in the second half of the night. And so you have to kind of be really careful, sort of like alcohol, they can kind of mess up those sleep cycles. So if you're taking it for a long period of time, it may actually make you more sleepy in the daytime than you want it to because it's actually disrupting your sleep overnight. And because there's a mild sedative effect too, but it's kind of a combination of the sedative effect and the fact that it's messing up your sleep cycles and you're not staying in certain sleep parts of the sleep cycle long enough. Okay, sorry, that was a mouthful. But they can be useful, but they're not really a long term solution.
Yeah.
I mean, again, there's we all have seasons of our life where we have to kind of bite the bullet and just we know we're not going to get as much sleep as we need to. I would say try to minimize those and work as much as you can to preserve your sleep in those situations. But then, really, really prioritizing it as much as humanly possible. But then if you do need a sleep aid, just realize that you're probably not going to want to use that for more than a few days at a time. And certainly not, on a like a basis for like a whole month or something like that. It's at that point, it's really time to get somebody to help you troubleshoot your sleep issues.
Yeah. So really that sort of, check in with yourself after
Mm-hmm.
2 weeks,
Yeah.
like,
Yeah.
hey, is this am
Yeah.
I, getting better or not? And then that
Yeah.
would be when to check
A
them.
lot of this really just requires some level of self-awareness to sort of
Mhm.
figure out what's really going on with yourself. I mean, you really need to at
Yeah.
least find a way to make space to get in tune with your body enough to know what's going on with your sleep and how that might be I can't talk. Oh my goodness, interacting with some of your other like GI issues and headaches and all of those sort of things are all related to sleep. So it's really kind of important to just kind of be aware of all that and how it's tying in together.
Yeah, that makes sense.
So
Well, we've talked about so much, I
a
know,
lot.
tonight and last week.
I know.
So this is a lot of great information,
Hmm.
though. So, it is saved on Facebook. So for our viewers and those who tune in with us, watch it again. I know Wendy put a lot of information out there. I'll be posting a couple additional resources for everyone in the comments. So go ahead and take a look in there. But Wendy, as our time comes to close tonight, what is, after both of our conversations, what is your, I guess, maybe number one takeaway for everyone when it comes to sleep?
I would say don't let it run away. Don't let it get away from you. If you're having sleep issues, find an hour or something to just really try to troubleshoot what's going on internally, what's going on in your mind, what's going on with your body, and make a plan. Because if you don't take the time to make a plan, you're really not going to get to the bottom of those issues, and you're going to get stuck in this really awful cycle. And so just carve out some time to really figure out, what's going on, look at your calendar and see when you can, focus on sleep for a little while, try to get some sleep, try to build in some of these like behavioral techniques we've talked about. And then, if it's not working, put it on your calendar. Like just go ahead and call the physician or call your nurse practitioner or PA and make an appointment, try to get in so they can the sooner you can start to figure out what's going on, the better off you'll be. And whether it's cognitive behavioral therapy that they recommend, or, if you end up going to a sleep study just to rule some things out, I mean, follow the plan. It takes some trial and error sometimes, and it's not just a simple one visit. Now we have an answer and I'm going to do this. Sometimes it is, and that's great. But oftentimes it takes a little more digging and a little more work. So just resolve that you're going to do the work and get it done.
Yeah. No, great. That's great advice. And again, I just want to thank you so much for your time, Wendy, and for all of the information that you provided for us. I think it's so informative. I know for myself, I learned so much. And I just want to welcome our viewers. We are just about halfway through our series, so continue to check in with us every Thursday night at 8 p.m. We'll be continuing sort of the sleep conversation in our core 4 next week, where we'll be talking about energy management. So that's going to be very interesting.
Yes.
So I want you all to tune in. So be sure to like the For Her page if you haven't already, and turn on those push notifications so you know when to tune in. But I just want to thank everyone for being here, and Wendy, again, for your time. And I hope everyone has a good evening.
Awesome. National Sleep Awareness Week is in 2 weeks. I think it starts the 14th. So you'll start to see a lot of good stuff coming out. So if this is of interest to you, just kind of keep your ears peaked on social media. There's going to be a lot of stuff coming. So if you're really looking for some good information, National Sleep Foundation is a great resource. And then I forget the name of one, but I sent you a link to it. There's some Project Sleep. Yep.
Mm-hmm.
So you'll start to see a lot of stuff coming out in the next couple of weeks. So just keep your eyes peeled.
Yeah. And I just put those into the comments.
Awesome.
So be sure to check that out for additional information and everything. All right. Well, farewell, everyone, and have a good evening.
Night.
We'll talk to you all soon.